these viruses. There are no vaccines against bacterial infections. All right. The thing about a virus is that it needs a host. It can only grow and replicate within a living cell. So if it's sitting on the table or something, it's going to die. Sitting on a surface, it's going to die eventually. Some of them last a little longer than others, but it has to be inside a person in order to replicate and cause a problem. Protozoa are little one-celled animals like amoebas. Ricsettias are transmitted by the bites of lice or ticks or fleas, and we call those vectors. Okay, the bug transmitting the virus is a vector. Fungi are one primitive plants. They're part of the plant kingdom. So you've seen mushrooms, right? Those are fungi. I have seen yeast infections so bad that they grow little looks like mushrooms in the skin folds. Okay, so it's a plant. It feeds on living tissue. Okay, thrive in warm, moist environments. Where do you think on your patient's body is a warm, moist environment?
Your foot.
Mm-hmm.
Underarm. The toes be one?
Toes are one, yes, in between the toes. Mouth, yes. Armpits, yes. Groin, yes. Anywhere where it is moist and warm. So you're also going to find it in skin folds.
Under the breast.
Under the breasts, yes. Those are areas that you really need to check thoroughly to make sure we're not getting fungi growing in there. Helminths are parasitic worms, tapeworm, roundworms, pinworms, okay? And basically like children get pinworms because they get their hands dirty in the dirt and then stick their fingers in their mouth and they transfer the eggs to their GI system, all right? And then other infectious agents like mycoplasmas and chlamydia. We just went through all of these, all right. Multi-drug resistant organisms, and somebody mentioned MRSA, vancomycin resistant enterococcus or VRE, any bacteria that produces ESBL or extended spectrum beta lactamase is resistant to a lot of different drugs. C. diff has now become resistant to our usual treatment, which is Flagyl. And you're going to see more and more patients getting Cipro for C. diff because the Flagyl isn't working anymore, or penicillin-resistant strep pneumonia. The reason these bacteria get, the reason they get resistant is because people are treating infections, bacterial infections, but they don't finish the treatment. So like you start feeling better after 7 days and you decide to save the other 3 days worth of antibiotics for next time, right? Anybody do that? Anybody have a family member who does that? Oh, I feel better, I'll save these for next time. All right, this is what is causing a lot of these multi-drug resistant organisms. All right. The other thing is that we're giving out antibiotics too much. We don't let the body take care of things. All right. We don't let the body take care of, use their own defenses to take care of something. So everybody wants an antibiotic right away. All right. Antibiotics right away lead to things like multi-drug resistant organisms. Okay, so there's a view of a virus. They are very, very small. You can only see them with an electron microscope. These are viruses here. Okay. So there is a way that infectious disease is spread from one person to another. And this way is a continuous chain. And there are 6 links in the chain. You need to know this chain, all right? First link is your causative agent. All right. This is your virus, your bacteria. Okay. Anything that's going to cause an infection is going to be your causative agent. Okay. So it's anything that's capable of producing disease, and it could be your protozoa, your prion, your fungi, your helminths, but mostly you're going to see viruses and bacterias. Okay. Now that causative agent has to sit somewhere. Okay, they just don't appear out of thin air. So what we call a reservoir is where these microorganisms are found. Okay, so what can be in reservoir? Think about your bacteria. Where are your viruses? Where do they sit waiting to get passed on to somebody else?
Hands.
Hands, yes. Okay, so they can be on your hands. They can be on surfaces. What else? People. Where in people though? Where specifically can a virus or a bacteria be sitting in a person? Look on page 220.
Infected wounds.
Mouth. Okay. All right, there are some that sit on the skin. Food and water can be a reservoir. Okay, especially for protozoa, for these one-celled animals, Giardia. Anybody ever had Giardia? It's awful. Okay, wounds are a source of a reservoir. Okay, because bacteria will sit in the wound. It could be your urine, it could be your lungs. You know, somebody has pneumonia, then the bacteria is sitting in their lungs, right? So there's lots of different places that these pathogens can be sitting, okay? And the best way to prevent an infection from spreading from the reservoir to somebody else is using standard precautions, okay? Good hand hygiene is one of the most important and effective ways of breaking the chain of infection. You can break it right here. Because if you come in contact with this bacteria that's in this reservoir, okay, and then you go to the next person and you don't wash your hands in between people, you're going to carry that from that reservoir to here. Okay, should have put up here the most effective way of getting rid of destroying a virus or a bacteria or any kind of thing is sterilization. Can't spell to this, sterilize. Okay. So go ahead and take a 10-minute break and we will get back into our little chain of infection here, all right? Back in 10 minutes, which would be 10:10. Okay, time to come back. Put your cameras on. All right, guys, we need to put your cameras on for lecture. I need to see your face, not the top of your head. So please adjust your cameras. Okay. So we're at portal of exit here. This is how does the bacterium, pathogen, whatever, get out of the reservoir. Okay, get out of the body. Okay, so an example of a portal of exit could be your GI tract. So somebody has infectious diarrhea. Coming out through the portal of exit is the GI tract. How about somebody who has a respiratory disease? Mycoplasma pneumonia or strep pneumonia or staph pneumonia, okay? That would be your respiratory system. Your respiratory tract. And there are a lot of diseases that are airborne. We know that COVID is airborne. Measles are airborne. TB is airborne. Influenza. These are all released when people cough and sneeze, okay? The skin and the mucous membranes can be a portal of exit when we have a wound that's draining. So this is how the pathogen gets out of the body. We can interrupt this by using transmission precautions, which we will talk about here in a little bit. Okay. Treat infected patients, so treatment. All right. And then isolation techniques that would keep that person from infecting other people. All right. That's how we stop that portal of exit. The next link is the mode of transfer. Okay, so this could be direct patient contact. It could be indirect contact. So indirect contact would be somebody contaminated an inanimate object. So let's say, something like mono. Mono is a virus, right? So somebody drank out of a glass that somebody else drank out of. That glass would be what we call the fomite, or the area where the pathogen is sitting, waiting for something else to come by and pick it up, okay? Vectors, fleas, mosquitoes, etc. Droplet infection. Droplet means that when somebody coughs, sneezes, or talks, the droplets come out of their respiratory system that have the bacteria or the pathogen in it, and it contaminates the air through aerosolization. So it's very small and it floats in the air. All right, so it could be direct contact, it could be indirect contact, it could be vectors like fleas, ticks, mosquitoes. All right, it could be from a droplet infection, airborne infection. All right, but we can break this mode of transfer by number one. What's the number one way of breaking a mode of transfer? Hand hygiene, okay? Hand hygiene, okay? Because if you've picked something up from a direct contact or an indirect contact, and you wash your hands, you're going to get rid of that pathogen, right? Disinfection. Disinfecting equipment. Wiping it down with bleach wipes, etc. Another way we could do this is using standard precautions. Who know what standard precautions are? Yeah, you use them all the time. What are they? Gloves, yes. Hand hygiene and gloves for everyone. We use standard precautions for everyone. Okay, masks are not part of standard precaution. Well, they are now, but they are not, they never used to be. All right, standard precautions are always hand hygiene and gloves. That's where we start with everything. Now, these days, everybody wears a mask. So that's going to become standard here pretty soon, I'm sure. Another thing we can do is control insects. Get rid of the mosquitoes, get rid of the ticks that are transferring disease. So let's say it does get transferred, it gets out of the body, it's transferred by direct or indirect contact. Now the person has to have a way for that to get into the body, okay? So portal of entry, it's got to get in the body somehow. What do you think would be a portal of entry?
Open wounds.
Eyes, mouth, skin, very good. Broken skin through your eyes, through your mucous membranes, okay? Your nose. Okay. Those are all portals of entry. Anything that can get inside the body, anywhere you can get something inside the body would be a portal of entry, right? So eyes, nose, mouth, trachea, or skin, consuming food or water that is contaminated. Okay. Breathing in droplets of pathogens. So when you're caring for your patients, you only want, how are we gonna block this portal of entry, right? So we only want to use clean and sterile items. We don't reuse things, right? Barrier precautions, your gloves, your masks, condoms, safe handling of food and water, good personal hygiene, avoiding high risk. Well, these are all ways to block the portal of entry. Avoiding high risk behaviors, avoiding insect bites. All right. But also, a susceptible host is necessary for any bacteria or pathogen to take over. Okay. So you can be susceptible because of age. So we have elderly and babies. Okay. People who are in poor health. Okay. Which is most of your people in the hospital, right? People with broken skin. So these are people who are all susceptible. All right, people who are in poor health, broken skin. We can help people not be a susceptible host by vaccinations, education, especially about hand hygiene. Okay. Staying out of crowds, social distancing, all of that. So we can stop that susceptible host. And then it starts all over again, right? We're back to the causative agent who is sitting somewhere that exits, gets transferred, entry, and then makes somebody sick again. So there are many ways that we can break the chain of transmission. Okay, those are important for you to know. Okay, barrier precautions, isolation, hand hygiene is the number one. We could probably use hand hygiene on just about every one of these. Okay, so your older adults are at higher risk. They're at higher risk because of poor nutrition. Okay, they are have inadequate hygiene. Immobility. Why do you think immobility is a risk for infection?
Because exercise is good for your health. And
Okay.
if you can't move around, it doesn't keep your body moving and processing correctly.
Correct. Not moving in bed. Yes. Not moving around. What happens is that if you're not moving, you're probably not breathing deeply. If you're not breathing deeply, then you're not getting rid of the pathogens that are in your lungs. Okay, so a lot of people get pneumonia from immobility. Okay, bed sores and broken skin, also another reason why people get sick from immobility. All right, you guys have all this? So. Guys, you have these PowerPoints. They are in your module. So you can get them and go over all of this stuff that I talked about on your own. All right, so your body has a lot of defenses against infection, all right? Remember we talked about homeostasis, your body likes to stay in balance. So we wanna make sure that your body is up to taking care of you. So the first thing we have are lysosomes, okay? Right here. Right here, all right? In your mucous membranes, we secrete these lysozymes that are, they're antibacterial, all right? We also have cilia in our respiratory tract. What does cilia do? It catches everything that you're breathing in and it moves the bad stuff back out. That's what causes you to cough, okay? Your liver has Kupffer cells. These are cells that attack bacteria and pathogens in the blood as it goes through the liver. And then your gastric secretions, you have a belly full of hydrochloric acid. Okay, not a whole lot of things are going to live in hydrochloric acid. We already talked about older adults being susceptible because of poor nutrition, immobility, poor hygiene, chronic illness, and physiological changes such as thinner skin. Oops, I'm going backwards, that's the problem. Okay, so your second line of defense, your first line of defense, okay, is intact skin. Your intact skin is the first line of defense against infection. Keeps pathogens from entering the body. Your second defense is a fever. Fever slows the growth of many pathogens until your other defenses can be mobilized. All right, fever increases your metabolic rate, makes things hotter, makes things harder for bacteria and pathogens to grow. All right, then we have leukocytosis, is where your white blood cells are stimulated and the leukocytes engulf the invader and get rid of them. After the leukocytes kill the invader, we have phagocytosis, where they remove all the debris and destroyed bacteria and metabolic waste products. So we have the white cells, and we have the phagocytes that come by and clean up all the garbage. Inflammation is another line of defense. We'll talk about that in a minute. And then if you have a virus, we have our body stimulates antiviral proteins called interferon that will help control the virus. So your inflammatory response. Anytime the cell wall gets broken, whether you cut yourself, you have surgery, a bacteria enters the cell, all right? Your body produces a localized protective response brought on by injury or destruction of tissue. And there's a very specific thing that happens when this happens, okay? First thing that happens is your blood vessels dilate, all right? Your blood vessels dilate, and they dilate because they want to bring more blood to the area. And what is that blood carrying? What's that blood carrying?
Is it oxygen?
Okay, it's carrying oxygen. It's carrying white blood cells. It is carrying red blood cells, clotting factors, okay? So your blood vessels get bigger to bring more blood to the area, and that's what causes your redness, warmth, and edema, okay? So that flow of blood to the area is going to make the area red. It's not necessarily an infection, not in the first 3 days, okay? It's inflammation. So this is going to neutralize and destroy harmful agents, limit their spread to other tissues in the body because of the edema, kind of walls them off, okay? And it prepares the damaged tissue for repair. This is why we have the inflammatory response. So first thing that happens is blood vessels dilate. Okay. After your inflammation, we have our passive, we have our immune system kicking in, your immune response. There are 4 different kinds of immune response. Okay, the first one is a passive acquired immunity. That means we give somebody the antitoxin or the anti-serum that contains antibodies or antitoxins to fight the disease. Second one is naturally acquired passive immunity. And this is when the fetus receives antibodies from the mother, either before birth or through nursing, etc. Artificially acquired immunity is your immunizations, okay? We're basically stimulating your immune system when we give you an immunization because we are injecting a dead version of the virus, and then your immune system is going to react, and then the next time it sees it, it's going to react quicker. And then passive artificially acquired immunity, we can actually inject the actual antibodies from the serum of infected people or animals. Okay, and I know they've tried that. They did that with Ebola. Ebola. They've tried that with COVID. Okay, taking antibodies from people who have actually recovered from the disease and injecting them into other people. So we have passive acquired, naturally acquired, artificially acquired, and passive artificially acquired. Important for you to know. So here's a question for you. Which person is at highest risk for developing a hospital acquired, and we call that nosocomial infection? Put it in the chat. Okay, I'm seeing a lot of threes. Why is number 3 correct?
Because of the age and the Lyme disease.
Right. So they're 80 years old. They have a diagnosis that is known to decrease your immune system. So the 80-year-old cancer patient is at highest risk for the nosocomial infection. All right. So now we're going to talk about how to protect people from all these pathogens that are out there in the world. 2 different types of asepsis. All right. Asepsis means we're making the environment and objects free of microorganisms. Asepsis is basically sterilization. We are sterilizing equipment to keep, we are using antibacterial soap to, get rid of the microorganisms. Okay. Medical asepsis. Okay, this is asepsis is getting rid of all the microorganisms. Medical asepsis reduces the number or reduces the risk of transmission. This is also what we call clean. Okay, medical asepsis is clean. Asepsis is sterile. Okay, so it's going to prevent the spread of infection from person to person. Okay, but it's cleanliness and protecting items from contamination and disinfecting contaminated items. Nothing drives me crazier than seeing somebody grab a MedNet machine or an IV pull from one room and just taking it to the other room without stopping to clean it in between. Okay, now you've just taken all the germs from room A and moved them into room B. And I'm sure the patient in room B doesn't need the germs from patient A, right? So yes, cleanliness and disinfecting contaminated items. Surgical asepsis means we're preparing and handling instruments and material that prevents the patient's exposure from living microorganisms. Okay, so anything that is going to enter the body through a sterile field, okay? Anything that's going to be invasive into a sterile area, it's got to be sterilized. We have to use surgical asepsis, sterile technique for this. So anytime you insert a catheter into a bladder, your bladder is a sterile area. We need to use sterile technique. Anytime you inject something into the patient, you need to keep the needle sterile because you are going through the first line of defense, which is the skin, right? We don't want to cause any infection under the skin. Hand hygiene is one of the most effective ways to reduce the number of microorganisms on the hands. Okay. Number one way. And hand hygiene would include washing with soap and water and using hand gel or alcohol sanitizer. Okay, as long as it's more than 60% alcohol. Okay. Now remember, it's only reducing the number of objects. Okay, so this is not sterile. You're not sterilizing your hands. You're making them clean. After we've done our hand hygiene, we want to put gloves on. Anytime you're going to come in contact with any body fluid, anytime there's a possibility of coming in contact with body fluid, you need to wear gloves. Okay. So you need to perform hand hygiene before and after you give care. You do it before you put your gloves on, you do it after you take your gloves off. This is why healthcare workers have such very dry, flaky skin. Okay, because you are washing your hands continuously. The only time we cannot use the alcohol-based hand gel or the Purell or whatever we're calling it, all right, is when we're dealing with C. diff. Alcohol does nothing to C. diff spores. You have to use soap and water for C. diff. So your standard precautions, all right. Hand hygiene and gloves. These days, mask, eye protection, and face shields. These are all standard, right? Putting on a gown to protect your clothing from getting contaminated so that when you go to the next patient, you're not carrying bacteria with you. Cleaning patient care equipment. Environmental control, which means that we put patients in rooms by themselves. We put them in what we call a negative airflow room. Negative airflow means that when I open the door to that room, air from the hallway goes into the room, air from the room does not come out into the hallway. We need to make sure that we're taking care of our linens, dirty linens, keep them away from you. Make sure you put them in a bag to transport them, okay? We need to pay attention to occupational health and bloodborne pathogens. And what would you do if you were exposed to a bloodborne pathogen, okay? So if you got a needle stick after you've given somebody an insulin shot, what would you do? It's the first thing you're gonna do. First thing you're gonna do after a needle stick.
Dispose the needle.
Yes, what else? What's our number one way of preventing infection?
Wash your hands first.
Wash your hands. Immediately wash your hands and then report it to your supervisor. But the first thing you're going to do is wash your hands. You also need to make sure you go to your bloodborne pathogen training. You need to make sure that you get your hepatitis B vaccines and get all three of them. Okay, these are what's going to protect you. And then patient placement, we put them either in rooms together if they have the same problem, or we put them in separate private rooms. So your gown gives you a barrier that's impermeable to fluid. Okay, so it must be impermeable. You can't just put a patient gown over your clothes and say that you have a gown on. First of all, it doesn't protect your arms. And secondly, if it gets wet, it's not going to do you any good. And there's a specific way to remove your gown, which we will be talking about in lab. Your mask, you want to apply it before entering a room if there's contact with airborne or any kind of splash body fluids. So if you were doing a colostomy or something like that, the chance of splash body fluids is high. You want to wear a mask. Needs to be over your nose and mouth. And then we have N95s, and I think everybody knows what an N95 now is. It's where it's a mask that will block 95% of the bacteria coming in or the virus coming in. All right. Usually used when there's pulmonary tuberculosis or other dangerous airborne microorganisms like COVID. Okay. So N95s are used for tuberculosis. Make sure you have that connection in your head. And 95s generally need to be fitted to the employee. So these are different kinds of masks, okay? We have the preform mask, we have the accordion mask. Protective eyewear keeps fluid from entering your eye area because remember your eyes are a portal of entry, right? Through splattering or aerosolization. So goggles, face shields, glasses, all are important to keep your eyes protected. If there's a contamination, danger of contaminating your hair, or if microorganisms residence in the hair might endanger the patient. So if you have microorganism in your hair and you might endanger the patient, you want to put a head cover on. But here again, we're going to remove all this so we do not recontaminate ourselves. Shoe coverings are covered so we don't carry pathogens out of the room. We remove them when we exit the room. You don't want to put your shoe covers on to protect everybody and then walk out into the hallway with them on. Gloves, we already talked about. This reduces the possibility of transmission of microorganisms from the nurse to the patient, also from the patient to the nurse. Latex allergy. Is there anyone here who has a latex allergy? No?
I do.
You do?
Yes.
Okay, who is I?
Salivatum.
Sumatra. Okay, so we need to be careful because in your lab bag, there are latex gloves, all right? So anybody who has a latex allergy, it could be just local inflammation, but it could also be anaphylaxis, okay?
Rashes.
Rashes, yes, itching, okay? So we want to use gloves appropriately, not for routine tasks. We don't want to put on gloves for everything. We want to remove them directly over the trash receptacle without snapping them off, because if you do that and you have latex gloves, you're putting latex in the air. And don't use petroleum-based lotions under latex gloves because it breaks down the latex and your hands react to it. We'll always ask our patients if they have a latex allergy. A lot of latex has been taken out of a lot of things, but not everything. There's still latex in Ted hose, okay? So you have to be careful. Sharps need to be placed directly in a special red puncture resistant sharps container, okay? Everything that's sharp that has contact with blood needs to be placed in the sharps container. Contaminated waste needs to be disposed of in an impermeable bag marked biohazard, those big red bags, okay? So soil dressing, used sanitary pads, suction drainage containers, and any other item that's been in contact with body fluid needs to go in a biohazard bag. Now you need to use whatever your policy and procedure is where you work, okay? Because obviously people who are incontinent, you're gonna have body fluids in things, but we're not going to put all the depends in the biohazard bag, okay? Only if they have a specific infection. Pathogens can be killed or inactivated by disinfection, sterilization, or sanitizing. All right, so disinfectants. This is like Clorox bleach and phenol. These are disinfectants. We do not use these on skin, right? We use antibacterial products on skin like alcohol and chlorhexidine. Right, so when we're talking about disinfection, we're talking about equipment. All right, so disinfection is going to eliminate some organisms after cleaning. The recommended disinfectant for people to use at home is 1 part chlorine bleach to 10 parts water. You will see that in multiple different forms as far as NCLEX questions go in exams. So 1 part chlorine bleach to 10 parts water. And then we use bacteriostatic or bactericidal. Bacteriostatic means we stop the reproduction of the bacteria. Okay, you still have the bacteria there, which is not allowed to reproduce. Bactericidal means we actually break the cell wall of the bacteria and kill it. Sterilization is the best method for eliminating microorganisms. When we sterilize something, we get rid of all microorganisms, okay? So these are the different 5 methods of sterilization. Usually steam, moist heat, hot air, ethylene oxide, radiation. Those are all methods of sterilization for equipment, not for patients. We don't sterilize patients. In the home environment, we want them to use that 1 to 10 solution of bleach. Run the dishwasher on the sanitized cycle or the high hot water cycle. Frequent damp dusting and vacuuming will reduce microorganisms because it's getting rid of the reservoir that the microorganisms are sitting in. And then any instruments that they use at home for dressing changes or whatever can be washed in hot water and detergents and then soaked in a bleach solution. Anything that people do at home is not going to be considered sterile. When they do it at home, it's going to be clean. It's going to be medical asepsis, not sterilization. Every building has an infection control nurse who watches to see where infections pop up and then tries to figure out why those infections are popping up in that specific area, okay? So they track the infections, they keep records, etc., and they assess for the spread of infection. Oops. So the most effective way to destroy all types of microorganisms. Okay, so we're talking about sterilization. We're not going to talk about 3 and 4, right? Because that's washing them in hot soapy water. That's not sterilization. So it's 1 or 2. I see some 1s, yes. Exposed to moist heat. Okay. 16 to 20 minutes, okay? Yes. So it would be 1. So you're going in for your annual review and you're told to stop by employee health to get a hepatitis B shot. What type of immunity are we providing this employee? What are your vaccines? Okay, I see 4. Yes, artificially acquired immunity. Because we are artificially putting the bacteria into the body. Brenda is a student nurse observing and assisting in the operating room. In order to maintain surgical asepsis, she must include all of the following except. So when you go into an operating room, we got to make sure everything is sterile, right? Are we gonna do a 5-minute hand scrub before entering the operating room? Yeah. Using sterile protective garb such as gown, mask, and gloves, yes. Sterilize all instruments and inanimate objects used in surgery, yes, we can only use sterile objects, right? Maintain clean technique while in the operating room. Are we gonna maintain clean technique? No, no, we want sterile technique. So yes. So it's 1, 2, and 3 here. All right, what we do, this is a following except, and number 4 is the correct answer. If you're working as a home health nurse, you're teaching your patient and family about asepsis in the home environment. All of the following are true except, so we're looking for what is not true. Are we going to do precautions in the home environment are important? Okay, so that's not the answer. Hand washing can be modified and is not as important as in the hospital. Is that true?
No.
No, that's not true. Hand washing has to be hand washing, right? So the answer is 2. All righty. Go ahead and take a break till 11 and we'll get into chapter 17, okay? Thank you. Okay, so let's talk about chapter 17, where we talk about infection prevention and control. Very, very important that you learn this information. Stuff you're going to use on a daily basis because you're going to be dealing with sick people, right? So there are 4 stages in any infectious process. Please write these down. Stage 1 is your incubation period. This means the organism's in the body, okay, and it's starting to reproduce, okay, but we don't have any symptoms yet. Now, it is possible that infection can be transmitted at this stage. It's not common, though. The stage we need to worry about is stage 2, your prodromal period, okay? This is that little period of time where you have vague symptoms, you're just not feeling good, but you're not sure what's going on. This stage is highly infectious, okay? This stage is where pandemics come from. I know that, you guys probably all got this chickenpox vaccine, but back in the day when I was in school, somebody would just not start not feeling good in class. And the next thing you know, within 2 weeks, the entire class would have chickenpox. Okay? Because they'd be sitting there and they are infectious at this point, but they're not sick enough to stay home yet. Okay? So, prodromal period, infectious, highly infectious. Very important for you to remember. Stage 3 is when we're actually sick, that illness period. We do the illness activities. We have localized and systemic symptoms. We have fevers, headache, malaise, disease-specific symptoms, increased white blood count, a rash, swelling, drainage, diarrhea, vomiting. All those things are signs of an infection, right? And it depends on the virulence of the pathogen and the person's susceptibility on how long you are sick. And then the 4th stage is convalescence. This is when the symptoms start to go away and until you return to normal. It's that area where we need that rest to heal, okay? Healthcare associated infections, HAI. These are never events. These are things that should not happen. They're happening because they're transmitted while receiving healthcare services. That can also happen with healthcare workers can contract HAIs. All right. So we need to make sure we're watching our patients at greater risk. So anybody with a surgical incision, with or without drain, why? What happens when we have an incision?
The wound is open and we're more susceptible to get infection.
Right, we've broken our first line of defense, right? We've cut through the skin. So anybody with an incision is at high risk for a healthcare acquired infection. Artificial airways, because we've put a tube down a sterile area, okay? Urinary catheters, we've put a tube into a sterile area. Those tubes are great tracks for bacteria to run up and down. IV lines. Implanted prosthetic devices. This is important because I know many people, and I've come across many people in my career that have had a new knee put in or a new hip put in, get an infection somewhere else and have it travel to that prosthetic device. So anybody with a prosthetic device like a new knee, a knee hip are at greater risk for an infection. Anybody who's getting repeat injections or venipuncture, if you're not doing it correctly, you could cause an infection. And people who are immune compromised, okay? So those are your greatest risks. Those are the people you need to keep an eye on. So we prevent it by using medical and surgical asepsis, standard precaution, and transmission-based precaution. So anytime we're doing an invasive diagnostic or therapeutic procedure, so anything that's going to be inserted into the body, IV catheters, urinary catheters, surgical procedures, we need to use strict aseptic technique. And what does that mean?
washing hands, wearing gloves, making sure that everything is sterilized.
Okay, so washing hands and wearing gloves, but you're gonna want to use sterile gloves, not just clean gloves, right?
Yeah.
Because those are strict aseptic technique is sterile. Okay, and then we want to use isolation to prevent contact between patients and others. So we need to monitor diagnostic reports related to infection. And which of those diagnostic reports would you be looking at? You know of any? So if you had a complete blood count that gave you the white count, would you be looking at that?
Yes.
Yes, because anytime your white count increases, they are fighting off an infection, right? We're going to observe patients for signs of infection. I mean, we're keeping an eye on our high-risk patients. Or if somebody just tells you they're not feeling really good, you're going to increase your monitoring of that patient to see what's coming up. All right. That is a test question. I've seen it on multiple places. Okay. If your patient says they just don't feel good or they're suffering from malaise, you are going to increase your observation of that patient. Implementing procedures to contain microorganisms. Once we know that they're sick, we're going to put them in isolation. We're going to start using masks and gowns and gloves and all of that. Properly handling, sterilizing, or disposing of contaminated items. Using approved sanitation methods, which means that if you have a patient with C. diff, you are using soap and water to wash your hands, not hand sanitizer. And then recognizing individuals at high risk for infection and implementing appropriate protection. So there are two tiers of standards here. The first one is your standard precaution. What is your standard precaution? What do we use on everybody? What is our universal precaution?
Gloves,
Gloves and
washing,
hand washing, yes.
Mask as well.
Okay, yes. So standard precautions, this is your gloves, hand washing. Okay. So this is avoiding direct contact with body secretions, except sweat. If they're sweaty, you don't need to put on gloves. Okay. Tier 2 is where we start our transmission-based precaution. And this is to interrupt the mode of transmission by identifying specific secretions that might be infected. So you may use transmission-based precautions alone or together, but you always use standard precautions. You always start with standard precautions and then add to it for the transmission. Okay. Standard precaution we use on all patients. Airborne precautions. Measles, varicella, which is chickenpox, TB. These are all pathogens that float in the air. They're very, very small. And if somebody's talking, if somebody sneezes, if somebody coughs, the pathogens are floating around in the air. So that's why we use airborne precautions. Okay. We use a special mask for TB, and which one is that? What's the name of the mask for TB?
N95.
N95.
N95 masks, okay? So standard precaution is your hand washing and gloves, mask. Airborne precautions, we're gonna make sure we use an N95 for TB at least. Okay. Now droplet precautions are airborne, but the droplets are bigger so that they don't travel as far. They're not gonna float around in the whole room. All right. So droplet precaution is for things like pneumonia, diphtheria, meningitis, and we're going to use precautions within 3 feet. Would be airborne. Otherwise, contact. Okay. So if you're going to be up close and personal with some of these people, then we're going to need to use your, that's 3 feet, not 2. Okay. You're going to use your airborne precautions. Otherwise, we're going to use contact precautions. And then we use contact precautions for GI, skin, wound infections, RSV, which is the retrosyncytial virus that children get, and herpes simplex. Okay. Meaning contact precaution, we're going to put a gown on, we're going to put gloves on to prevent us from transferring it to somebody else. So, personal protective equipment, PPE. That's your gowns, your masks, your gloves, your hair covering, your shoe coverings, all those things. All right. So we never touch with our bare hands anything that contains fluid from a body surface or cavity. All right. Any kind of fluid, including saliva, urine, feces, and blood. Okay. The only time you don't wear gloves is when you're in contact with intact skin or unsoiled articles. So remember our nursing process? Who remembers what the letters to the nursing process are? Starts with an A.
Assessment, diagnosis,
Okay, so we have assessment,
diagnosis,
planning,
Implement.
implement, and
evaluation.
very
Great.
good, very good. Add pie, right? So as a nurse, you're always going to be thinking in nursing process terms, right? So assessment, that's our data collection. This is where we're looking for signs of infection. And and also specifically those that may require transmission-based precautions. If you have a patient who has had really stinky diarrhea, you don't need a doctor's order to put in contact precautions. Okay? Get the stuff out because you suspect that it is C. diff and get started immediately. Okay? Wounds need to be assessed each shift for infection. Monitoring patients' temperatures, especially if they're at risk for infection. If they have an infection already and we need to make sure that or they're on an antibiotic, we want to take their temperature and look at the admission labs. Your nursing diagnosis for just about every patient you have is risk for infection. Related to what? Surgical wounds, open wounds, weakened condition, malnutrition, immobility. All right, anything that's going to put them at risk for an infection would be in your nursing diagnosis. Then we're going to plan. We want to have our expected outcome is that there are no healthcare associated infections. Okay, because that's what we need to prevent. All right. And then we also have to plan if we're going to use transmission-based precaution to get the equipment out there so that the nurse and the aides and everybody else going in that room can be prepared. All right, so that is also part of your planning. Implementation. Not only do we have to get the equipment out there, we have to teach people. We have to teach the patient why people are coming in gowns and masks and gloves. Okay. We need to teach the patient's family that they cannot go into the room without the protective equipment on. You need to teach the patient's family how that infection gets transferred and what they can do to prevent carrying it home with them. And then ways that, how to put on the PPE, how to take it off, how not walking through the hallways with your PPE on, anything like that. Okay, everybody gets standard precautions. Hand hygiene, and yes, we need to teach families how to wash their hands too. Specimen preparation and transportation. Sometimes you have to get a specimen. Sometimes you need stool or urine or blood or sputum, okay? You need to collect your specimen. Okay, you want to label your specimen before you walk in the room. Label your container, because you really don't want to pull your pen out of your pocket while you're in this room with your dirty gloves on, right? So label your specimen container before you enter the room. Collect whatever specimen it is. Place it in a leak-proof container without contaminating the outside, okay? So try and get it all in the container, not on the outside of the container. Then you're gonna put that specimen in a biohazard bag, a little baggie, and take it to where it needs to go. Do not leave it sitting on your nurse's cart or on the nurse's station. Put it where it belongs. If we're dealing with soiled linen on a patient with an infection, we want to handle that as little as possible. When we take off the sheets, we want to roll them up and put the inside in or the outside in. All right, so the part the patient's been laying on, we want to roll it up so that's inside and then put it in the linen hamper. And if they're on transmission-based precautions, you should have a linen hamper in the room so you're not carrying anything down the hallway. Trash and biohazard waste, disposable soiled equipment should be placed in plastic bags. A biohazard bag may be needed. Sharps container, everybody gets a sharps container. Doesn't matter whether they have an infection or not, okay? Drop that sharps into the sharps container immediately, okay? And this is the important part. Replace your sharps container when it is 2/3 full. Don't be the one that's going to shove one more needle in that sharps container and then end up getting stuck on a needle that's in there already. Okay? When it's starting to get full, replace it. I know it's a pain in the neck, but somebody's got to do it. It might as well be you. It protects you and everybody else you work with. Patient's placement. Okay? So people with transmission-based precautions should be in a private room or with another patient infected with the same organism. So if they both have C. diff, they can be in together. If you have to transport a patient on transmission-based precautions, please make sure it's absolutely necessary and give them a mask to wear outside the room if it's airborne or droplet. If it's contact, make sure they're in clean clothes, they've washed their hands. Yeah, things to prevent other people from coming in contact with that. All right. At home, we want to make sure they keep their clothing and linen away from others until it's washed. Told you how to teach them how to do proper hand hygiene. Need to disinfect the bathroom with a 10-to-1 bleach solution and probably the kitchen and the bedroom. And wash the dishes in scalding water and let air dry. Sometimes they are using needles at home and they don't always have a sharps container. So if they have a heavy plastic jug, like a juice jug or a milk jug with a secure top, they can put their needles in there and then put them in a plastic bag and send them to the trash. They need to use clean gloves for wound care or dressing changes, okay? And we need to show them how to take off the soiled gloves and throw them away. We're not going to reuse those gloves. I know they're expensive. And a lot of times in home care, you're going to find people reusing equipment because it costs them a lot of money. And a patient's room needs to be cleaned frequently. Sometimes we put our patient in isolation to protect them. If they have a very low white count, they have no immune response, we need to put them in protective isolation. So anybody gets put in a special room with its own ventilation system, a negative pressure room. You don't want anybody who has an active infection in the patient's room. And we need to remain aware of the facility's policy and procedures regarding protective isolation and follow them at all times. It can be things like they can't have flowers or fresh fruit because they can carry in bacteria and viruses, all right, or protozoa. They can't, everybody who comes in the room needs to be masked. Again, they should wear a mask when they leave the room, those kind of things. If you have a patient in isolation, you need to be careful and watch out that they are not having sensory deprivation. Signs of sensory deprivation and decreased self-esteem are boredom, slow thoughts, disorganized thoughts. They sleep too much during the day and they're awake at night. They have anxiety, they have hallucinations, and they have panic attacks. Okay. If you keep somebody in isolation, they are going, if their brain is not engaged, their brain's going to give them something else to watch, and that would be your hallucinations. All right. So if you have somebody in isolation, make sure you talk to them, find things for them to do. Maybe they like to do puzzles, or maybe they need to watch a movie or read a book. Okay, but make sure we're keeping them engaged. Okay, so infection prevention and control for the nurse. This is for you guys, okay? OSHA is protecting you. They're protecting you from exposure to bloodborne pathogens. The three main things that you are going to be exposed to are puncture wounds from contaminated needle or other sharps, skin contact, so if you have allowed blood, body fluids, or other infectious material to enter you through damaged or broken skin. And remember, we're washing our hands 100 times a day, so you're sure to have some dry, flaky, broken skin. And then mucous membrane contact, allowing infectious materials to enter the mucous membranes through the eyes, mouth, and nose. You'd be amazed. I've had students who had patients who spit at them. They got it in their eyes and they got sick. Okay, so make sure that we're protecting our eyes. When we're doing surgical asepsis, that means it is sterile. When you're using sterile technique or using surgical asepsis, there are 4 things you need to do. Know what's sterile and what's not sterile. Separate the sterile from the unsterile, and remedy contamination immediately. Okay, if you're doing a sterile technique and somebody says, hey, you just broke sterile technique, don't get mad at them. They're protecting the patient. Okay, so reset it up. You have a duty. If you see even a physician breaking sterile technique, you need to tell him, help him. Okay. The whole goal is to keep the area free from microorganisms, right? Your surgical scrub is lengthy and more vigorous than regular hand hygiene. We are trying to remove as many microorganisms as possible without damaging the skin. Okay. The timing is on time spent scrubbing. It doesn't include rinse time. And it's usually 2 to 5 minutes. It says 4 here, but 5 minutes is pretty standard. Okay. And we're using an antimicrobial agent to do this. We're using special soap. And you're scrubbing all surfaces of the hands and up the arms. Okay. You guys are going to practice this, but I'm just going to go through this real quick. Okay. Perform hand hygiene before you open up anything sterile. When you open up a sterile packaging, you want to open it up away from you. Don't toward you, away from you. And touch only the outside wrapper. We never, ever, ever reach across the sterile field, which means if we're putting our sterile field down, we're not going to go this way. We're not going to put our arms over the sterile field. We're going to put it down so that the sterile field goes out and we can bring our arms back towards us. Never turn your back on a sterile field because you have no idea what's happening behind your back. You could be brushing up against it. Your patient could be getting into it. You never know. And allow at least 6 inches between the body and the sterile field. You're gonna go through that more in lab. So we've done our assessment, we've planned, we've implemented all those things we just talked about. Now we're going to evaluate, okay? Did our patient get a healthcare acquired infection? And hopefully the answer is no. Okay? We also have to assess whether the patient's infection's been transmitted to any other healthcare worker, okay, or any other patient on the unit. Things like C. diff spread like wildfire. COVID will spread like wildfire, okay? So we have to make sure that we keep our patient's infection contained, as well as preventing other infections from getting to the patient. All right. During which stage of infection would a patient be irritable, fatigued, experience malaise, have an elevated temperature, and be considered highly infectious?
Two.
Yes, it would be 2. Remember that prodromal period where we have malaise, we're just not feeling good, but we don't have specific temperatures or specific symptoms yet. And it is a highly infectious stage. Okay, so number 2. Mary is taking care of a patient with tuberculosis. What specific type of precaution should she take? Only have 2 people who know the answer to this. Come on. Let's get some more people up there. There we go. Yes, airborne. Tuberculosis is an airborne disease. When taking care of a known tuberculosis patient, the nurse must wear what? I see a lot of 3s. That's good. Yes, a particulate filter mask. An N95 is called a particulate filter mask because it filters out the particulates in the air. In opening a sterile package, a nurse should do all the following except. So we're looking for what's wrong. Do we want to put it on a moist tablecloth at eye level? Do we need to wash our hands? Do we need to open packages away from the body and lift the front flap up and towards the body, handling over only the outside wrapper? Oh, I see a contradiction here between 1 and 4. Okay. What happens if we put a sterile field on a moist tabletop? It breaks our sterile field because that moisture can carry bacteria up into your sterile field. Why do you think it's 4? I think you're right, but why do you think you're 4?
Because they putting towards the body.
Right, the front flap should go away from the body. But they said 1. This should be away from the body, not towards the body. So if you said 4, you are also correct. Okay, that's it. So let's look at some stuff in your book here. We got a half hour. All right. Look at table or box 17-1. on
page?
page 245. And the rest of you put your cameras back on for me. Minanatu, Michaela, Shamari, Davina. Okay. Thank you. We just went over chapter 16 and 17, Jessica. The PowerPoints are in your Canvas. All right, so let's look at this transmission-based precaution requirement. It's a standard precaution we're using for everybody, right? So what diseases do we need to use airborne precaution for?
Would you like us to name some?
Yes.
Okay. Let me see.
TB,
TB is the big one, yes. Okay. Pulmonary tuberculosis, very highly infectious. Okay, what else? I know we don't see these very often, but rubella or measles and varicella, which is chickenpox. That also includes disseminated zoster. So somebody who has shingles all over their body, at the beginning, they are on airborne precautions. What's the difference between airborne precautions and droplet precautions?
Airborne, you don't need direct contact, and then for the other, you do need direct contact. Like droplet, you need direct contact with the virus or whatever it may be.
Okay, I think I know what you were saying. But if you had airborne, where is the pathogen going to be hanging out?
Or like in the air, like if you cough or
Right.
something,
Right.
and then it can
You're-
travel to someone else.
Mm-hmm. Airborne, you're walking through a sea of disease, okay? It stays in the air a long time. So when we go into a room with airborne, we want to make sure that we are protected from head to toe, right? Droplet precaution, the droplets are bigger. They don't stay in the air that far. How far away can you, is the restriction on contact or droplet, I'm sorry.
3 feet.
3 feet. So arm's length, okay? If you're going to get within arm's length of this patient, then you're going to need to have a mask on and goggles and everything you would put on for airborne because it's still in the air. Outside of that, you also have to remember that those droplets are going to fall on surfaces. So then we're going to be talking about contact. At 3 feet, okay? So what kind of diseases are we talking about here? Some of them are pretty
Meningitis.
common.
Meningitis.
Meningitis, yes.
Pneumonia.
Pneumonia,
Pneumonia.
mycoplasma pneumonia, yeah. Who knows what pertussis is?
Whooping cough.
Whooping cough, yes, okay. And pneumonic plague, which hopefully we don't ever come in contact with. All right, and then there's a very common one here. Streptococcal group A pharyngitis. That's strep throat. How many of you have had strep throat? How many of your kids have had strep throat? Okay, now they're supposed to be in droplet precautions. because it does spread, okay? Remember that. Okay, influenza is spread by droplets. Okay. So, and then in addition to that, we have contact precautions. All right. So your GI illnesses, your respiratory illnesses, okay. C. diff is contact precaution. If somebody has E. coli or Shigella or Hep A, if they're diapered or incontinent, respiratory syncytial virus, RSV, skin infections that are highly infectious like diphtheria, herpes simplex, okay, abscesses, cellulitis and pressure injuries, scabies, lice, okay, those are all contact precaution. Conjunctivitis is contact precaution. So you guys need to know the diseases that go with these types of precautions. Look back here on page. There was a chart here somewhere. All right. The other thing I want to look at, see if there's care plan in here. Okay, so let's look at on page 248, nursing care plan 17.1. All right, you're the nurse. How are you going to plan to care for your patient? This is what we read care plans for, so that we know and understand how to take care of a patient. So our patient is under airborne precautions. I think they started on the page before us here. I'm sorry, they started on 247. So your scenario is Doug Gamble, 18, pulmonary TB. He's in a private isolation room. It's his 10th day of hospitalization. And he told the nurse he's feeling rejected because everyone wears a mask when they come in to see him. So your nursing diagnosis or your problem, remember what did we talk about with patients in isolation, right? Now
What
it's
page are we on?
247. So the problem is he doesn't understand infection precautions. So he has a knowledge deficit. Okay. And our supportive data, and you're going to learn more about subjective and objective data next week. Okay. But he states that he cannot understand why he has to stay in his room, why people wear masks. That's subjective. Anything the patient says is subjective. Objective is his PPD, his skin test is positive. Sputum culture is positive. He has cavitations in the apex of his right lung, which means lesions. And he has a medical diagnosis of active pulmonary TB. Okay. So that's the data that's supporting our problem. That's why he needs to have infection control. So first thing we're going to write is our goal. What's our expected outcome? What's our plan? So the plan is that they're going to understand the need for the transmission-based precaution and the pathogen that they have. And how are they going to do that? There's your interventions. Teach them about the causes of pulmonary TB, the transmission, and the need for masks, and then good hygiene, hand hygiene, respiratory etiquette, including covering your mouth when you cough. The rationales are for why did we pick these interventions? And then the evaluation is, does the patient understand the need for precautions? And if he states he understands the needs, then you're good. Otherwise, we have to go back and try this again. Okay, so I want you to look at the second problem there. So what is the problem? What's our second problem here for Doug?
There's no visitors supposed to be
No
there.
visitors, yeah. Impaired social interaction. What is your objective data?
The patient is supposed to be in an isolated airborne room, like the precaution.
Mhm. Has he had any visitors?
Yes, but they have to be where we
This
have
is
visitors.
parents.
Okay, yeah, visitors have to wear a mask, and the only visitors he's had is his parents. Now, this guy is 18 years old. Where's his friends? Right? So we're gonna plan some expected outcomes. We would like him to have visits at least once daily with his friends and family. And how are we gonna get that?
Using proper PPE.
Okay. And how are we gonna get the friends in there?
They need to wear the N95 mask.
Advising the patients with the proper PPE they can visit during visitation hours.
Okay. Look at the nursing intervention.
And also ask the patients if they can make use of mobile devices, their phone, video call, and other stuff.
Right, mobile
Suggestion.
devices, FaceTime, those kind of things will help too. But first thing we're gonna do is we're talking to parents and remind them that people can visit if they wear the proper PPE. I think using the mobile devices is a good idea. Cuts down on the infection. Okay. So these are care plans that you can, look at and say, well, what are the other problems my patients are going to have? Okay. Same thing with the droplet. Social interactions impaired, doesn't understand, those kind of things. Look at box 17.2 on page 251. These are the things we need to do. We need general practices, principles regarding isolation. We have to assume that the floors are contaminated. Even when they're not in isolation, we have to consider that the floors are contaminated. So anything you drop needs to be cleaned or thrown away. We want to minimize dust. We want to establish contaminated and clean zones in the room. So right inside the door, you can establish a clean zone where you have your PPE and all of that, a place to take your stuff off before you leave the room. Contaminated would be anything after that. We do not remove anything from an isolation room unless it's in a proper bag. All right. So that means that, are you going to use your own stethoscope in this room? You're not going to use your own pen. You're not going to use any blood pressure cuff, thermometer, blood glucose monitor. All that needs to be in the room and stay in the room. Okay. All your equipment should be in the room already so that you're not taking it out of your room and taking it somewhere else. It's always a good idea to put supplies